So today we're going to be talking about a complex wound, and we're going to be doing a wet to dry dressing. What is the purpose of this type of dressing? The purpose of the wet to dry dressing is to mechanically debride the wound. This is when we apply coarse gauze moistened with saline and pack it into the wound bed. The packing is then allowed to dry and then removed. This can occur several times a day. The reason of doing this is that when the old dressings are removed, dead and necrotic tissue is going to be removed with it. This is to promote granulation tissue and healing. Why do we want granulation tissue? Granulation tissue is new connective tissue that forms on wounds to heal. It heals from the bottom of the wound bed and up. The granulation tissue is vascularized and it is considered healthy tissue. We use the process of debridement to promote this. How do we begin to remove the old dressing? To remove the old dressing, we must first carefully unattach the tape to the skin. The original wound dressing will be applied and secured with adhesive tape. Gently remove the tape by pressing on the skin as you lift the tape up. We do this to prevent any injury to the skin, such as tears. Next, you will grab the top of the ABD pad. This will be the padding that is on top of the dressing. We will try to grab from the middle, grabbing all of the gauze with it from the wound bed. Next, we need to do our assessment. We're going to assess using something called codes. This will help us to determine the wound status. Is it infected? Is it healing? Or do we need to call for further intervention? C stands for color. Is it red, black? What color do you see? Odor stands for O. Take a whiff. Is it a foul odor? Is there no odor at all? D stands for drainage. Is it sanguineous, serosanguineous, serous, or purulent? Are the edges approximated or not approximated? And what's the size, length, width, and depth? To measure the depth, we want to take a sterile Q-tip, place it in the deepest part, and slide your fingers down to the edge. Then we're going to compare it to the guide, so be sure not to touch your hands to the wound. Sterility. This process should remain sterile. Sterile means there is no bacterial life. We do this because of the high risk of infection in these types of wounds. First, we will obtain our needed supplies, our 4 4x4s, an ABD pad, sterile water, a sterile bowl, a sterile drape, 2 packs of sterile Q-tips, sterile gloves, and adhesive tape. First, we will open our sterile drape. We will then need to open our sterile Be sure not to touch the surface of the drape to anything. You have a 1-inch border around the sterile drape that may be touched with your hands. Any touching inside this border will contaminate, and then you will need to start over. Next, open up your needed supplies and place them in the middle of the drape. Be sure not to allow anything to touch outside the 1-inch border, or you will need to start over. This includes the gauze, the Q-tips, and the ABD pad. Next, you will need to remove your sterile bowl and place it onto the table. Be sure not to touch the bowl and use the outside of the wrapper to your advantage. Now check the expiration date of the sterile water. Is it up to date? If not, you will need to obtain a new bottle. If it is, continue by pouring it into the bowl. Do not reach over the sterile field to pour the water, and be sure not to get any onto the sterile drape or you will need to start over. Now you will need to don your sterile gloves. Be sure to always keep your hands above the waist after they are on, or else you will need to remove them and replace them with new ones. Now it is time to pack the wound. You will now need to take about 2 4x4 gauze and stretch it out. Place the stretched out gauze into the sterile water. Once it is soaked, you will need to wring it out so that it is not dripping. Be sure not to drip your sterile drape or you will need to onto your sterile drape, or you will need to start over. A little bit is okay. Now take the first gauze into one hand and twist the end so that it will fit the corners of the wound. Obtain a sterile Q-tip to allow you to pack the wound. Gently place the gauze into the wound and use the Q-tip to pack. Continue this process until the wound bed is completely covered. Be sure not to have the packing touch anything outside of the wound bed. This will be considered a contamination. Now you will need to take 2 dry 4x4 gauze and place over the wound, or however many you need until it is covered. You will then need to place the ABD pad on the top in order to cover it. Make sure the blue line is facing the sky on the combine pad. Now tape the ABD pad on all 4 sides. Make sure the tape is labeled with your initials, the date, and the time the dressing was changed. Always label the tape before you begin. You do not want to write on the patient. This will be painful. Administer needed pain medication and assess how the client tolerated. Now you're all done.
Alright, first, check your order, sterile water. Check the expiration date. It is today. Next, sterile drape. Going to open it up, pick it up by the corner, shake it out, only touch the 1-inch border. I'm going to lay it on the table, just like that. Next, I have my sterile bowl. I'm going to open it up. Be sure not to touch it. And lay it out just like that. Next, I'm going to open up my combine pad and drop it in the middle. I'm going to open my gauze. Drop it in the middle. All 4 packs. Now I'm going to open up my sterile Q-tips. Okay. All right. Now I'm going to pour my water into the bowl. Okay. Now I'm going to prepare my adhesive tape. Just like that. I'm going to leave it on the side. And then I'm going to label my initials, the date, and the time on the tape. Okay. So now I'm going to wash my hands. I'm going to apply clean gloves. Okay. Next, I'm going to remove the old dressing. Now I'm going to wash my hands. I'm going to apply clean gloves. Okay? Next, I'm going to, while you remove the old dressing, you're going to gently be careful with the skin, removing the tape, being sure not to cause any skin tearing. Next, I'm going to grab it from the middle. I'm going to try gently grab the gauze from underneath. I'm going to pull it out. Now I'm going to look at the inside and assess for drainage. So this is where codes comes in. We're going to assess for color. The color is red. We're going to take a whiff. There is no odor. There's no drainage. The edges are well approximated. And now we are going to assess for size. When assessing for size, we're going to be sure not to touch it. We're going to use centimeters, and we're just going to hover over closely like this. It's about 10.5 inches. And then we're going to measure the width. And that'll be about 2.5 inches. And be sure to go to the widest part of the wound. Next, I'm going to open another block of sterile Q-tips, being sure not to touch the cotton end. I'm going to place it in the deepest part of the wound and drag my finger down. Now I'm going to compare it to my measuring guide, and it is about 3.5 inches deep. Now I am removing those gloves and washing my hands again. And now I'm going to apply my sterile gloves. Next I'm going to apply sterile gloves. I'm going to open it up, grab this out, and I am able to touch this. I'm going to open it up. Be sure not to touch the inside. I'm going to grab the first one right here. I am able to touch the inside of the glove, but not the outside. I'm going to apply. Next, I can touch anywhere on the next glove. So I'm going to hold it like this and slide. And now you can fix as you please. Be sure not to. Alright. Now I'm sterile. Next I'm going to take 2 sterile gauze. I'm going to spread them apart. Just like this. Now I'm going to put it into the sterile water. And I'm going to do this for a second one. And you can do this for as much as you need, or whatever you think you're going to need, to sufficiently pack the wound bed. I'm going to place it in there. Okay. Now, I'm going to take one out, and I'm going to be sure not to drip, or at least not a lot, onto the sterile field. I'm going to wring it out, being careful. Now, after I wring it out, I'm going to spread it back out. just like this. Next, I'm going to just put it in my hand just like this. That way, I could put it where I want it and utilize it. I'm going to twist the end just like this so I can get it into the corner. And I'm going to grab a sterile Q-tip. I'm going to dip it in water just so it helps it to stick better. Just a little trick. And then I'm going to... Now, maintaining sterility, I'm going to place my twisted corner, I'm just making sure that it's all set, into the corner of the wound. Be sure not to touch the skin, only the wound bed. I'm just going to use the Q-tip to guide myself to place it in, making sure it doesn't touch any of the skin on the outside. Now I'm going to go back this way. Okay. Now I'm going to grab my second one, doing the same thing that we did with the first. So I'm just wringing it out, making sure nothing gets on my sterile field. I'm going to spread it apart. Just like this. Place it in my hand once again the same way. I'm going to twist the end. Now I'm going to go back into the corner once again with a new Q-tip. Do not reuse the same one. I threw out the old one. And I'm going to go into the corner once again, maintaining sterility, only touching the wound bed, not the skin. I'm going to throw this Q-tip away. Take 2 new sterile Q-tips. And I'm just going to help it make sure that my wound bed is covered. And you'll continue this process until it is. Throw these away. Now I'm going to take my dry sterile gauze, place one over top. I'm going to take another one and do this until the wound is covered. Now I'm going to take my ABD pad with the blue line facing up. I'm going to place it over top. Now you do not have to worry about being sterile anymore, so you can remove these gloves. You can keep them on, whatever you would like. Now I'm going to tape the edges. Now always be sure to ask allergies before placing the tape. Some people have an adhesive allergy, and you may need to use special tape for that patient.